Eric Hammer here, registered physiotherapist and owner of Home Comfort Physiotherapy. Today, I'd like to talk about one of my favorite exercises to give to patients who have what's referred to as a flexion bias nerve irritation. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So this exercise here, I like to think of it as though you're opening up, right, the space where nerve roots come out of in the lower back. So essentially, when we think about the spine, we have our individual vertebrae. In between the vertebrae are what's referred to as discs. And then coming out of the spine are these nerve roots. And these nerve roots, what they do is they form peripheral nerves. You can think of them almost as a root, right, that goes down in the lower back, down the leg. And what can happen is if we have a little irritation of these nerve roots that come out of the spine, certain positions and movements can provoke these peripheral symptoms. So perhaps like a sensation of a shooting pain down the leg, a numbness, a tingling. And there'll be certain positions that might, as you bias those positions, will peripheralize those symptoms. So essentially create more and more pain down the leg. And then there'll be other positions which ideally, as these are repeated, will centralize the symptoms. So for example, somebody who's presenting with sciatic-like symptoms, maybe again a shooting pain that goes down perhaps even into the foot area. What we're trying to do is again create and bias the positions that in some instances will open up that space, as we said, and others will compress the spine but maybe impact the disc in a certain way. So the one I'm going to talk about today is when your leg symptoms, your peripheral symptoms, when they improve with flexion-based movements in through the spine. So flexion is basically a bending forward type position. So a great exercise that I find, and this might be, for example, somebody who has degenerative changes in through the spine, in through the disc, which basically creates less space between the vertebrae. This potentially might be a good exercise for a patient like that, where again, a flexion-based movement improves the peripheral symptoms. So essentially, I'll just have the patient in a sitting position like this, and then I'm just going to have them repeat, right, this bending forward type position. We're going to go right to end range. You can hold for a second or so, and then you're going to come back up. And then typically, right, I might have the patient do this for 10 to 15 times and perhaps throughout the day as needed. And again, this would be for somebody who, when they bias these flexion-based movements, their peripheral symptoms improve. Thanks again for watching, and feel free to leave a question or comment below. Please check with a physiotherapist to make sure that this or any other exercise is appropriate for you. Thanks again, and have a great day. Take care.